We're welcoming Tom Langer today, our Cowley County Public Health Officer. He's going to present Cowley County COVID update. We've got some bio comments on the back side of the agenda. Well, Tom's already been here in our community 5 years, right? It's amazing. I do remember when you came. He is a Cowley County Public Health Officer, also administrator of the Cowley County Health Department. And he has found that during these 5 years, his job has been challenging and rewarding also. So, of course, we're taking the challenging part up a little notch now with the pandemic. Well, he'd done a lot of other things, too, before coming here. 10 years with the Kansas Department of Health and Environment. He was the statewide director of the Bureau of Environmental Health and served as the lead officer for pandemic response materials, warehousing, and distribution. He's currently chairperson and KDHE Regional Coordinator for the Southcentral-Metro region for public health emergency preparedness. He is a native Kansan. He hails from Lawrence, and he has spent most of his life residing in the Topeka area. He's married and has 5 adult children, received his education from both Washburn and University of Kansas. So let's welcome Tom to our assembly.
Thank you very much.
Yeah, thank you. Here's your
Okay, there we go.
your little clicker thing.
So the topic of the day and every day. I appreciate the opportunity to come and chat this morning. Nothing has happened in my lifetime professionally that has been so all-encompassing and just all-evolving that it has basically just sucked everything into it the way this last 10 months have been. I commented to a colleague not too long ago that the biggest change between a year ago and today was the fact that a year ago I was thinking what's going to happen in 6 months and a year, and I had a plan for the things that we needed to accomplish. 2021 is the 75th anniversary of the local health department, and I was all excited about doing the preparations for, public health awareness and all of that. And lo and behold, on a Sunday afternoon in early March of last year, my life changed dramatically. And while I would be lying to you if I said a year ago at this time I wasn't aware of the threat, I honestly did not at that point in time make the assessment that would be in Winfield or in Ark City or anywhere in Cowley County that we would even be threatened by this until fall. I was only wrong. And greatly so. And of course, when it's all said and done, the history that will be written about this, even locally, I will go back because I have saved all of the notebooks, and there are many with all of the notes that I've written over the time. And sometimes even today when I look at them and I look back at the beginning, I think, oh, how foolish I was here. And, oh, I really got it right here, but man, I missed it there. So there will be a lot to look back on, and I won't rehash the history, but instead I'll jump forward to today and kind of give you an idea of where we're at currently, what the threats really are, what we are doing, and where I think this is going to go. Okay? So part of it, of course, is taking a little bit of a look back. We'll just advance it.
Yes.
And so what I'm going to do real quick is pop up a slide that I think one person in the audience I know has seen this. And it's just some numbers. Now, why are numbers important? In health and in anything that you do, if you don't chart things and if you don't look at things in mass and try to ascertain what's happening by what the numbers are telling you, you're not doing your job correctly. And that is a big part of what I do. This was data from the 8th of March when it all began through the 10th of November. Okay, And if you guys can remember back in early November, there were a lot of things going on. Not the least of which was the mushroom cloud for COVID-19, and infections in Cowley County was just starting. Okay, and you'll see why graphically here in a minute. These are some. I think I have a pointer here. Yeah, doesn't show up on the screen. These are some communities, of course, that comprise our great little county. And you can see at that point in time we had tested, and I was proud of the fact that we had tested over 6,000 folks. We had 861 positive cases. 861. I was just appalled. That was terrible. In November, early. Things have changed dramatically since. You can see our rates. You hear me talk about these rates so very much, and I will explain some of them to you. But in reality, what we were looking for here is how many people in our population that we tested have been positive. That's basically all we were looking at. Okay, are we stable? Is it growing? Is it is it falling, and so forth. Whoops, back going the wrong way. These are the numbers from yesterday. Okay. Now, they're different because what you're seeing on this is just me looking at school districts, not the communities in general. And this is just me looking at the last 2 weeks. Now remember that number that we had, Phil, on that last slide? 800? Okay, that was from March to the 10th of November. In 2 weeks, just passed 741.
Right.
So in 2 weeks, we did what we had done
That whole time.
in that whole time period. Now, as the public health officer, do you think that gets my attention?
It gets ours too.
It gets my attention. And yet I continue to, have some of these wrestling matches with things that go on all the time. And you can see the rates. We were at 13, now we're at 33. And for 2 weeks. If I were to take a look at it all in aggregate from the very beginning, the number of tests have changed again very dramatically. As of noon yesterday, you can see the numbers of what we've tested. If I do the quick math, oh wait, I take that back. I'm looking backward. Yeah. This is for 11/11. Okay. This was the total number of tests back then up to that 6,000 point. You can see we had, sadly, 14 people that perished. You can see the distribution based by age. Okay, November the 10th was not that long ago.
No, absolutely.
Today is
Today's
10th?
the 9th.
9th, 10th, yeah. I lose
So
track.
it's about 2 months.
2 months.
2 months ago.
Oops. So here's where we are.
Oh.
So now, take a look. Now you can see these are the number of individuals that have been tested, the number of people that actually became ill. Look at the deaths.
Yeah,
50 people yesterday. I am now talking about deaths like I once was talking about cases, and that makes me exceptionally sad because this number has now become de-identified to me. I could tell you exactly the entire life story of those first 8. I can't hardly tell you anything about the last 42. And that's sad.
Do we fall in a high per capita death rate like many counties in Kansas do, or are we still pretty moderate in per capita death rate?
We are, I would say we're tracking right with the statewide norm at this point. We seem to have a little bit higher incidence, I think because of the demographics of our population. There's a portion of our county which is, of course, older, and they are adversely affected by this. But this number, this 50, is not just residents in our long-term care facilities. No. No. There are too many 30-somethings in that pile. And when you have a 30-something that passes away and leaves behind a spouse and young children, that's going to fall on the responsibility of the rest of us in the community for generations now. But you can see what's happened, okay? And when I look at it, it does paint kind of an ugly picture. It really does. And I don't always want to be gloom and doom, but the good news is, if this virus had been as vicious to the young as it has been to those of us that are older, I think there would have been insurrection in the streets long ago.
Yeah, you'd have a lot of
Because
deaths.
if our babies were dying,
Yeah.
okay, this group right in here would have been outraged. They would have come after me with tiki torches, even though there's not much I can do to stop it. But I think perhaps maybe messaging would have been better taken. I really don't know. It's been an extraordinary exercise in understanding, you know, what goes on in society, and understanding how people interact and how they respond to their self-interests and what have you. And you can see that in each of the age groups. And you don't want to have to try to project what they're going to do, but past behavior generally is a good indicator of what will come and what will happen. And we're seeing that even now as we enter a new phase of what's going on. Here is some interesting graphical data for you to look at that is very much like what those numbers just showed. This was before Thanksgiving, okay? So that same slide, based upon those same numbers. See where we were in March? We started it off and everybody was afraid. Do you remember when everybody in this room probably thought I was some kind of a psycho because I said, hey, if you've gone on spring break and you've gone out of state, I want you to be, I'm issuing an order for you to stay home for 2 weeks because I was afraid. Why was I afraid? I was seeing it on cruise ships. I was seeing it in Disney World and in theme parks in Florida. And where did people go on spring break? Families went on vacations. And when, of course, what happened then was early in March, we had the confirmed cases in Kansas begin in Wyandotte County and the first death. And so that really caught my attention. Luckily, we were able to kind of clamp it down all the way through. And looking back now with 2020 clarity, I'm thinking to myself, gosh, we could have had all of those graduations and everything else and we would have been fine. But you don't know. You just never know. So you err on the side of caution. Early on, we had a lot of people sick right here. We were chasing a zebra in a field of spotted horses, looking for that thing, trying to find it. And that field of spotted horses, those black and white horses, was enormous because we had a really nasty upper respiratory virus last year about this time, really starting to take hold and move through our population. And it was bad. As a matter of fact, when we first started testing, in the very limited capacities that we could do it, I thought the tests were wrong because I saw so many people so violently ill. I said, what? This has to be what they're talking about. And every test came back negative, negative, negative. And then, of course, I was under the torch at that point in time because you're not testing enough. You've got to do more. And we didn't have the swabs. We didn't have the tubes. We didn't have the labs to send it to. We couldn't test because we just didn't have the capacity in any way. That began to change. Come May was really the first month where we started having ample supplies of everything for us to do our jobs. And you can see how the numbers jumped. And I thought, wow, look at us. We've done 500 tests in the county. And we've not found anything. Oh, we're doing so good, But still, we weren't prepared for what was coming. And then right in here is where the first true outbreak of COVID-19 hit Cowley County. And I call it my famous four. I had 4 people that shared a carpool ride, and they were part of the, I'll just say they were part of the blue-collar community as opposed to white-collar, however you want to describe it. They worked in local industry, and they rode together. One of them had gone to a county in southwest Kansas for a party where that person was exposed, came back, rode with the other 3. Those 4 were our first 4 cases. that we absolutely knew. I knew where it was, I knew who they were, and from there we watched it. Those 4 grew into 60 over the next several weeks. And it showed me really early just how virulent this could be and how contagious it could be. So that happened in here. So you can see we went from 495 one month, that was our total. We jumped up to almost 800 tests. So we added a large number based upon what we had been doing up to that. And we thought, we were doing okay. We got that corralled. We were tracking it. We were worried because this is what caused the community of our Kansas City to get out in front of everybody on that list. And that 100 or so cases that came from that developed in that time period kind of put them apart from everybody, and it's skewed the data against our Kansas City since that point in time, because they're never going to you can't unring that bell. Once you have them, you've got them. But the rest of the county did a magnificent job catching up in the not too distant future. So anyway, our testing capacity increased, and we started doing really well. July and August, we were still tracking that, but we didn't have much here. This was all during the time when the great debates began. And Bill, you know exactly what I'm talking about, the great debates. Should we wear a mask? Should we not? Is this something real? Is it not? And I made the proclamation of it's not real unless it affects you and you have somebody get sick and die.
Yeah.
Then it's very real.
Yeah, right.
Other than that, it doesn't seem to be so much. In August, end of the summer months, people were still enjoying the outside time and everything else was going great. And something happened in the last weeks of August. We had a bit more social gathering. We had a lot of weddings. We had a lot of outdoor picnics. And then we come to the first weekend of September, and we had a holiday. And every single holiday that we've had this year has been followed by a dramatic increase in cases being located because of the fact that this is, without a doubt, an illness or a disease. This virus is spread by personal contact. We know now that I can come here and wipe my hand on all kinds of things, and the probability of me getting sick from something on the surface is really, really slight. It doesn't happen. We thought it would because we thought it was like flu. We found out it doesn't live outside the body very long.
12 hours.
It's, in a lot of cases, not even that. And, we've drowned ourselves in hand sanitizer, and we've got so much hand sanitizer in Cowley County right now that I think we could provide every citizen in the county 3 bottles, to use for the remainder of the next couple of years. Anyway, so we were able to start understanding more and more and more about what we were facing and what we were looking at. And in September, like I say, early September, we had a rash, a surge again in cases that were all attributed to social activity. There's no other way around it. There were a couple of really large weddings, and those were very dramatic because in those populations, I had the person say, Tom, we didn't think we were having anything wrong. I said, how many people did you have? We had 150 people. I said, where did you have them? I said, you couldn't do this in our backyard.
Oh, okay.
Now, I've got a pretty good sized backyard for my house here in Winfield. I can't imagine 150 people being in it, without it being
Stuffed.
we're going to be on top of one another, and of course for what's going on. And these weddings were large, so you had the setups, you had the rehearsal, you had the dinner, you had the event, and then you had the party. It wasn't just I'm in and out in 15 minutes. Okay, so anyway.
Was school a factor in September?
It was to a point, but not yet. Because it was just starting.
Okay.
They were just starting to go back. This other was the big part. Okay. And so they came in. And then, of course, we did have kids go back to school. And there were 2 age groups that I found most interesting. Freshmen in college and seniors in high school. Think about it. I was both once. Okay. Senior in high school, you couldn't tell me anything,
Right.
because I knew it all. Freshman in college, I'm away from mom and dad. I can do whatever I want now.
Yeah.
And they do.
Party
And they
time.
did. And they did. And so we saw that dramatic increase in that demographic that was that 19 to 25 grade group. It jumped big time. And we had a lot of cases there. Do you remember the volleyball team? You probably read about it in the paper and all of that, you know, all of those things that come in. So you had to get that under control. And when I say under control, it means every time we have an outbreak like that, it takes roughly 6 weeks for us to get it back down if we can control behavior at that point. And so that's what happens. But in that time period, CMS, the Centers for Medicaid Services, came out with their guidance for long-term care facilities that said if in your community you have an infection rate, that rate that we talk about, over 10%, you must do the following. You must test every resident at least weekly, and you must test each employee weekly. Okay, so all of a sudden, in September, we had 7 long-term care facilities perform thousands of tests. And that's why that number jumped. It wasn't because the population was ill. It was because the population that was very much cloistered was being forced to be tested. Okay? And so you can see now, when activities like that come in, the data starts to get noisy. It becomes skewed big time. And you have to be able to tease all that stuff out. So that's why we went from here to here. We did see an increase in rate. We did see, an increase in illness, but we didn't see an increase in infection rate. And as a matter of fact, it was absolutely inverse. We tested so many people at that point in time that were negative that the ones that were positive, which is a very, very small fraction of that. And so we went from like about a 10% rate down to about 2.5%, which allowed the long-term care facilities to pull back and not have to test the next month. See the drop? Mm-hmm. That's what explains what happened here. Okay. In October, we hit a low water mark for illness in the community. Mid-October, you can probably look it up in the paper, I issued to David the numbers. I think we had like 38 active cases in mid-October. And you know what happened? This.
No more masks.
You got to see your faces. Because we're all right. We've made it through this.
Right.
It's over. Next month, the election. This is all going to be gone by the end of November. That's what it was happening right there. And then this happened. So, now you saw where we were. And look.
Big ones.
Now that's just tests. Okay, you'll see in a minute what we found in all these tests. For the first time, these numbers that were artificially driven were no longer artificially driven. End of October, people were out doing everything we had a beautiful October before the ice storm. Do you remember? It was gorgeous.
Yes.
It was why you live here.
Exactly.
Okay?
Pristine.
It's beautiful. And I mean, we had great big gatherings in parks, we had our concerts, we had everything that was going on outdoors. We were doing flu shot vaccine drive-throughs, and talking to people, and everybody was happy, and we're out there wearing masks in the heat and just sweating, and it was awesome, messy. And at the end of the day, we had Parks and Rec come in. They had a cornhole league, and we weren't even out, and I turned around as they're all in there setting up, and they're throwing their bean bags and everything else, and I looked back and I counted 85 people, 2 masks, in Winfield, with an ordinance. and the signs on the wall, and the same people telling me all the time how I'm supposed to be doing my job. I have had my moments. Okay?
Yes.
So, anyway, this month taught me something. It taught me that I was really pretty not smart, and I forgot some of the basic principles of public health, and that's how virulent it could be and how infectious it could be. Because in that 4,153 tests, I'm telling you, we saw 3,000 plus people that were really sick. And it took me all the way back, and I remembered what we had going on here.
Wow.
And I'm like, what is it? What is it? What is it? And only this time I wasn't disappointed. Now, before Thanksgiving, here's our positive cases by month. Okay? Notice here, this was telling me something. It was trying to, and I wasn't listening. 129 cases in the first 10 days of a month is pretty alarming.
Sure.
Guess what? We're doing that much in a week sometimes, or more since.
Sure.
Okay. This is what it ended up.
Oh, yeah. Positives.
See that?
Wow.
Look at
That really.
this. Really talks the
Yeah.
talk
November.
about what happened in Cowley County.
Wow.
And it wasn't just Cowley County. We weren't alone on this. We weren't an island in the sea of COVID. No, it was happening all around us, but it did not spare us. This was the month where I said, I don't know what we're going to do. Because we were taxed. I actually had 5 people out sick during that time period. 20% of my, 25% of my staff was gone. And we're trying to man up to meet the response in ways that we had no idea. I mean, it was just, we didn't know who to call first. And there was no help from the outside. We were all just basically, okay, let's do it. Let's plow ahead and do what we can. So sadly, in this time period, all of the number counting quit. All of the fun stuff that I was able to put out stopped because it just got so blurry. When you sit there and you go from having, 3 or 4 maybe new cases a day to 30 to 40 a day, and you have to contact them, you have to call them, you have to follow up, and you only have a certain number of hours in the day, it was overwhelming. And yet, by the time it was at the end, we had kind of figured out how to do it. Because it's amazing what you will learn or you will adapt to when you're forced to. Okay. And December looked better. Don't ask me how. I guess only because we only had 567 sick folks in December. Inside of here, a lot of interesting things took place. If you followed the press and the fact that the health department is the one place in the county where you can still call and get a test, during the week, relatively easily in the mornings. We moved from just down the street because we were causing such traffic tie-ups in town.
Sure.
It was ridiculous, but it hadn't been that way. It had been working fine. We would maybe go out in the morning and we saw 20, 30 people, and it was great. And all of a sudden, that 20, 30 went to 50 to 70 to 120.
Yeah, it changed in 1 week.
Yeah,
Like.
and where did we looked, and the cars, were all the way up 8th Street one direction. We looked up, and they're down, and they're around the building, and the fire department's complaining because they can't get out if there's a fire, and we're like, we
can't.
So that's when the plan came. We moved to the fairgrounds, and even the first week or two at the fairgrounds until people got the idea of how it was going to go. The lines were up on the 9th out on the highway. It was just insane. We said be there at 9 o'clock. People were sitting in their cars for 2 hours waiting for tests, and we were going as fast as we physically could go. And now we know we can do tests. We can do 100 tests in about 2 hours if everything goes smoothly. And that's including giving away boxes of goods and freebie stuff now, but it's just, there is a process to it. And the one thing people never did understand, and we tried to tell them, please call us. Call us in advance, not because we're going to turn you down, which is a fallacy. It's because if you tell us the stuff on the phone beforehand, we have all your paperwork ready to go when you get there. And then we don't have to stop everything. You get a car with 4 people in it that want to be tested, and we have to fill out 4 sets of forms to get all that information. It makes that line stop. And we were having that go on, and I mean, you know. And the other part about moving to the fairgrounds is the fact that we were out there one week when it was snowing and raining. And I said, I'm going to kill my staff. No, I mean, literally, they were going to die because they were going to catch pneumonia, you know. So anyway, that's health department issues. It's been fun. Something happened interesting around Thanksgiving because I was really feeling melancholy. I told my wife, Kelly, I said, I don't know. I says, next week is going to be so bad. She goes, well, you don't know. I says, I know. I says, they haven't listened.
Right.
They
don't.
They're like kids. I mean, my kids, you know, you tell them, Dad, you don't know what you're talking about. And they'll, oh, I wish I would have listened. And then all of a sudden, it didn't happen. Right after Thanksgiving, it didn't happen. And I don't know why. Other than people listened, finally. I think it took all of this to finally convince it. And not just that, but you know that 50 number that we looked at a couple slides ago? That's when 40 of those happened.
Yeah.
So suddenly, it was closer to home. I want to know by show of hands, do you know anybody here that's had COVID? Do you know anybody here who's lost somebody to the illness? Okay, when it's that widespread, you know, it's not the flu anymore. So anyway. So, as of yesterday, in the last 14 days, okay, we have 260 active cases. That means 260 of our residents, our neighbors, have tested and have it. But end of story, okay? 87 of those were in long-term care facilities. That's an incredible number. We fought so long and so hard to keep it out. And we saw so quickly how devastating it is once it gets in. And the only way it was getting in were by people that worked there. And that's sad, because we tried. And they didn't do it maliciously.
So the 87 is residents, not staff.
Well, yeah, it would be residents
Residents
in long-term care facilities. And we've had a lot.
Do you know offhand how many long-term beds there are in the county?
Oh, gosh. Between the 7 facilities, probably close to 1,000. Okay, and that's excluding the Veterans Home. Veterans Home is, you know, much larger. And I will tell you, and I forgot about them, because that actually makes 8. Every single one of the long-term care facilities has had to do battle with this now. I don't mean to pick on any one person, but I remember standing in the lines, working with my staff in the morning, talking to a person who was a nurse, and this really just broke my heart and made me mad simultaneously. And she says, I just don't know why I'm here. I'm like, okay, explain. Well, I was tested at facility A, and I was told I was positive. And so they sent me home, and I went to my other job at facility B.
Oh, no.
And they tested me, and I was negative, and so I worked. Okay? And I'm like, you want to come again with that? So you tested positive, and you decided that that was wrong, and you went to work somewhere else? Uh-huh. And then they sent me here. Good for them. We tested. She was positive.
But she had already been to that other facility.
It resulted in 6 illnesses in one facility
Uh-huh.
and 72 in another.
I believe it.
That one person,
Mhm.
one person,
Wow.
was responsible for almost all of that number.
Yeah,
We know which one it is.
That's how it is.
that's how it works.
That's how sneaky it is.
Absolutely.
And she didn't even feel bad. I mean, literally, illness-wise.
No, but she was seriously
And
inferior.
that's
for
what it
And
was.
she had a positive test and a negative test.
And then we
That's
hammered
part
it.
of the problem.
And
And then we hammered that, and we were like,
she got a positive
oh.
here.
MG. Yeah, and I had
Yeah.
other words.
Yeah,
but-
that's a
Well,
challenge,
yeah.
for
But that's
sure.
it. Now, currently, I think within the last week, we've had like 12 folks hospitalized locally
Mhm.
with COVID. That's in between the 2 hospitals. Their little COVID wards are full.
Mhm.
Their ICU beds are full.
I believe it.
Okay. Our capacity in the county is not that
It's
large
pretty small, really.
because we don't normally, sit there and say, hey, we're looking for an event that's going to make 30% of the population ill.
Sure.
Okay, and sadly, we will take a lot of folks and they get diverted and they're out. And so they go to the other hospitals in the region or across the state or wherever they can go.
Or out of
And so
state,
we kind of, I hate to say it, we lose track
Mhm.
of where some of our folks are. And then I finally, sadly, learn about it
Mhm.
when I get a call or an email telling me that I've had another death of a resident in the county.
Mhm.
And it's just, like I say, it's heartbreaking because every one of these people has family. Every one of them is friends to somebody here. 161 total cases in the local population. So that means if you're not in the hospital or you're not in a long-term care facility, we have 161 folks in the county. And they're spread pretty evenly. You can probably take about 50% in Winfield, 50% in Arc City, more or less. We'll smatter a few around. We had some spikes in some of our smaller communities, like Burden and Atlanta. One time we had 38 cases in Atlanta. I didn't even know there were 38 people living in Atlanta. Sorry folks.
Well, it's pretty small.
This is a map, and I don't know if any of you frequent the health department's website. We now have a link to this because we quit putting the numbers up. They change so fast
Mhm.
that the moment I put them up, they're out of date. And so this is the state's. This is a picture of when you hit this. It'll take you directly to the state of Kansas. It'll show you this. I apologize for this one being blurry. The resolution was really bad. This was back in that time right around November. Remember that 10th of November? This is what the map looked like on the 10th of November. So you can see us down here. We had 861 cases. Sedgwick County was cooking already with 18,000 cases, but we weren't as bad as Wyandotte. So gosh, we had that going for us. That was one of the-
Butler was pretty busy
Butler
too.
was
21
busy. Yeah, Butler was
2100.
busy. They've always been a little bit more so.
Yeah, Reno.
Uh-huh. And
Almost
then
3200.
here's what it was
Oh,
at the
man.
beginning of last week.
Oh, wow. Ooh, now we're really cooking.
Uh-huh.
Yeah.
Notice the difference?
Now look at Cowley's numbers.
Look at
here.
Cowley County. We went from 800 cases to 2,700 cases.
2,700.
That's from the 10th of November.
Mhm.
I've been a busy guy.
Yes, you have.
So people say, "What are you doing, Tom?" I just kind of chuckle.
Just trying
I
to
just,
survive.
just trying to
basically.
find
to
good reasons.
survive.
You were talking about
Look
Butler.
at-
They went
oh,
from 27 to
six-
55.
6,000, yeah.
Mhm. Look at Sedgwick County.
Mhm.
Sedgwick County is now the
Yeah.
leading
Yeah, look
one
at
in the state.
Sedgwick.
So it's. But I'm not pointing fingers. Trust me.
Well,
Because
we know
here
how
it
happened.
was. This was yesterday.
Yeah. It
This was
quickly changes.
yesterday's numbers.
Mhm.
So 2887. If you go to the map right now, that's the number it will show. Monday at noon, it will be different.
Are there still beds COVID beds in the state, or are they?
In the state, there are some. They're few.
A few?
They're few. Anyway, so see, this is the reality of what we're in right now. These counties out here, Finney, Seward, Ford, okay, Lyons County, they blew us out the door in the summertime because that's where the meat packing
The
plants are, the
meat
big
packing
ones.
plants,
Hey, but you know what? There's a county that's got a big meat packing plant. It sits right here.
Yeah.
We never did that. You know why?
Yeah.
Because we did our jobs.
Oh, yeah. Well, and the facility, Creekstone, they took it serious.
They got on the phone with the public health officers, and what do we have to do?
Yeah. Well, and
And
they're
we told
owned
them.
by the Japanese, and they're very, very concerned
And
about
we
that.
told them, and they did it,
Mhm. Yeah.
and they effectively kept it out.
They've
It-
done a
It
great
is a
job.
when we go back and write
That's incredible.
about this someday, you know, in my retirement,
Yeah.
I will actually take a look at that, say, this is how you do it
This is how you do it.
in a situation like this. Not that I ever want to face one again. I'm getting closer and closer to that magic day. And I guarantee you, this is my last pandemic.
Yeah, right. Your first and your last one.
Oh, no, it's not been the first, because when I was with the state, we had H1N1, we had other ones.
Oh, you had some
And we had all kinds of emergency response, tornadoes, things like that. But you know, those are all discrete events.
Yeah, and they start and stop.
Right, they're discrete events, and you can get through to the end. This one has just been, it's been a train that has not stopped at the crossing. So this is where we're at, like I say, right now. And so where do we go from there? There is another PDF file in there that's, I think it's Kansas update, maybe for January.
Kansas
like-
121.
Yeah, that's it. I want to share something with you. I get information constantly. There we go. Can I scroll?
Well-
Will this allow me to scroll? Probably not.
Probably not.
I'll have to have you do that for me.
Okay.
This basically is the state report that comes out to us, and you know, it tells us about all the stuff that we already know, and so we just burn right through this, and we get what we want to do, if we can, is move down to
Okay.
where we start having the real fun pictures. Keep going. There we go. All right. This is something that I get that tells me statewide what's going on. Okay, so I get a pretty good picture. Those other maps, it keeps us you know, informed about what's happening with the larger population that we make up, only 35,000. I want to keep going. It'll tell us all of this good stuff that you can find on the website at KDHE, but here we go. These are maps that come again off KDHC site. You can see how all of these things work, and you see, you know, and notice, remember how my charts looked? Remember I was in low, and boom?
And boom.
See how it kind of, so it happened statewide. We weren't, like I say, all by
You
ourselves.
weren't an anomaly.
Yeah, we
right?
weren't an anomaly. I wish we would have been. And this shows testing rates
Oh, yeah.
and all of that, and positivity rates. I'm not even going to go there until we get to this next part, because this is the part that I'm sad about, because, you know, a lot of times we want to be, you know, in the top group in the state. Okay, this is an interesting report that talks to me a lot about what's available in the state as far as hospital beds and admissions and all of that kind of good stuff. We get that data. I will say this about Cowley County. We talk to each other. We don't have, there are so many counties I talk to where the health department doesn't talk to the hospital. And I'm like, how do you do that?
Or why would
You know,
you
or
not
why would
want
you do
to?
that? Yeah, I mean, because it's like, I don't want to have to do all this by myself. But I also think it goes to the fact that what you probably don't realize, or I don't know if you do, I hope you do now, is that your health department is really structured differently than every other one in the state. Spare one, and that's the one in Lawrence, in Douglas County. Lawrence, Douglas, and City Cowley. See the difference in the names as opposed to just the Cowley County Health Department? We are structured because we are responsible to both, you know, to the cities and to the county as a whole, and that's the way we're structured. And so the mayor or the commissioners don't have to also serve as the Board of Health. We're a little bit different. We have to come to the community every year, show what we do and why, and we have to ask for funding. And we get a portion of that, and then we go out and leverage that with other grants, and we do that with what we do, and that's how we operate. Okay? I'm not a county employee. I work for the Board of Health. Anyway. Oh, you found it.
Found it.
You knew where I was going, didn't you?
This is not good.
So this is not good. This is not good. If you could see this, you would see that now Winfield, don't feel badly. The CSMA or whatever they call it is actually the two cities together. Winfield, Anarch City, because we are our own little unique metropolitan area. We're far enough away from Wichita that we don't fall into their MSA. We kind of have one of our own because of what goes on here, which is kind of nice. We have been flirting in this group for the last couple of months. We were as high as number 6.
Oh, wow.
But the county itself never cracked the top 12 until just this month. So that tells us that we are still in an area where there is a lot of activity going on.
Right.
Okay, and so that's sad news, and I put that out there. So what's good? And what's good about all this? The vaccine. If you are a cook and you are making an extraordinary meal, and you have all the different appetizers and then you have the soup and the salad and the rolls and the main course, you get on that and you work on all of those things, and then comes the great ending, which is going to be your dessert. For months, I felt so greatly inadequate that nothing we would do or we would say really made any difference. I felt like I was battling a tank with a slingshot, because the only thing we could do was ask people to behave. That's it. The only thing we could do was take away your liberty by saying, stay home, close your business, don't do this, don't do that. It was always don't do this, don't do that. You know? When news of the vaccine came out early on, I was immediately skeptical. It's my nature. You know, I'm in my 60s. I've lived long enough to know how long these things take. And I was like, well, being a doubting Thomas, you're going to have to convince me. Okay? Because I am going to have to stand up in front of people and tell them why they should, or what I know. And so on those evenings after I would go home, I would take with me the journals and every bit of information I could get, and I started reading, and I started reading with a great appetite, because I was looking for anything that we could tell people that could ease their suffering, shorten their illness, what we were trying to do, what we were trying to accomplish within a population, and to give them some hope, because it just seemed hopeless for so many people. And then the vaccine stuff came out, and I read it, and I read it, and I read it, and I'm like, now let me get this straight. How is this being made again? And then it dawned on me just what a miraculous time that we're living in, and what a magnificent medical opportunity exists right now. Much the same way that in our lifetimes we saw the advent of things like penicillin and antibiotics and other vaccines. But what was so different was how technology in medicine has changed to actually allow this to occur in such a rapid fashion. Are there risks? You bet there are, because we haven't seen it long enough. Remember, SARS, which stands for the acute respiratory ailment. You know, that's what SARS means. If you were to, it's an acronym in a world where we're nothing but acronyms. And the COVID-2 part of it, of course, is different, because of all the coronaviruses that are out there, and I believe there are 9 of them, if my memory serves me correctly. 7 of them are benign. They are so nothing that all we do is get the common cold from them. But we actually do test for those, believe it or not. If you ever go into the hospital, if you're really sick, they will run what's called a viral panel on you. And in that viral panel, they narrow it down to 100 of the most common respiratory ailments you could have out of the tens of thousands, and they'll scan for those, and it'll come back and it'll tell you what it finds. So it'll be, SARS, or coronavirus, or pneumonia, or whatever. It can find those things in those analyses. Anyway, the fact that we've come that far in being able to diagnose means that, wow, it took science, medical science, basically 90 days to map the DNA of the virus. They were able to find it that quickly and map it at that kind of a level. Now, could you imagine if we could have done that with measles once upon a time when I was a kid? I mean, I had to go through them all.
Polio.
Yeah.
Polio.
Because you look at what, and people say, oh, it's going to be like polio. And I'm like, it's not, because in polio, what we did is we thought we were pretty smart back then, because those marks, do you still have those marks on your arm that I do?
Yeah.
Because I got the smallpox vaccine, and I didn't get one, I got 3 because they didn't know if it was going to take or not. So I got 3 rings on my arm. My grandkids looking, what is that? You have to tell them about
It's
that.
your badge of
Yeah,
honor.
and it shows how old you are,
Because they would pick at your skin and turn it, make it a boogie. That's how we knew we could develop an immunity if we were exposed to the virus, and the only way you could expose yourself to the virus is to give yourself a little tiny piece of it. Okay? Not with this. Not anymore. This vaccine has nothing to do with the virus itself. What it does is they map that thing out, and you've seen the pictures. That little, looks like a jack. Okay, that's the picture of it in a microscopic view. And what you're seeing in that is what's called the spike protein. Imagine an M&M. Okay, we all have had M&Ms. What's on the outside? It's a
That
coating.
hard candy shell, right? And what's inside is where the virus is. So here's what the vaccines do. The vaccines have identified the outside shell, okay, the protein. And that protein is really, for all intents and purposes, just made up of like lipids and fats. But it's the external structure that the virus is in. It's that external structure with those little fingers that if you inhale it or you get into your system, that it lodges to the receptors that are the first ones in your body for an upper respiratory infection. Guess where they are? Have you had the tests? Have any of you in here had to have one?
No, but you're talking about how far you stick that thing up there, right?
It's behind. I've had it. It's behind your eye.
It's like,
Okay.
it's scary to me. I don't want it. It's like real.
I've had it.
And you did live.
No, I lived. It made my eyes water, and I'm like,
Ooh.
But yeah, you do survive it. Now I'll go through that 100 times before I want to go through the actually getting ill with. But anyway, that's where those things go. They get up there, and that's where in our body we have receptors these things will latch on to one another. Okay, so medical science now has looked at this. The biologists and all these folks in the labs, and they're way smarter than I ever will be, because I work in public service. These guys were able to understand all of that ribbon of DNA to where they could go to the one sequence and say, this is what we want right here. And they were able to extract that and replicate that. And what that sequence is the part of the virus that tells that shell how to construct itself. Okay? You with me?
Yeah.
And so what this does is you get the shot, which I've had the first one, and it tells your body here in the muscle, do this. And it builds it. Okay, so it's like, if you build it, it will come. So you get the shot, and my arm got sore. And I said, well, okay, that means it's working, you know, and I'm like waiting to hear the messages from Bill Gates and everything, and nothing came. Okay, you with me? And my arm got sore, and that was it.
And that seems to be an important story, is that we're not giving COVID to people with the vaccination. We're giving something that gets red, doesn't let it enter into us. Because it seems like we have too much hesitation on the part of a lot of really smart people that don't want to get this vaccination.
It goes to so many things about, oh, I don't trust it, I don't trust my government, I don't trust this.
Yeah.
I'm like, okay, I'm not going to fight it.
Yeah.
And I'm going to explain why in just a second. I'm going to finish my story. So anyway, so what that does, now I've got this RNA in my body, okay? Oh, it's going to change me on a molecular level. No, it doesn't. But what it does tell, it tells the cells of that muscle where that went in, create this. And it did. Okay? So it created spike proteins. The empty shells were there. And my body said, that doesn't belong here. And my automatic immune response geared up. And that's why I had the ache in the arm for a few days. As though my body was working on that to get rid of it. Okay? So that's what happens. Now, next week, I get shot number 2. And that is going to be the fun one. Same thing, exact same dose, exact same shot. But what's going to happen now is my body already understands this thing doesn't belong here. Okay? But it's like I went and I stopped by the grocery store on the way home from work because I needed milk and eggs and bread. So I got 3 things in the little cart. Okay? Next time, I'm going grocery shopping. Yeah, I'm going to get the whole cart full. So now what's going to happen, my body's going to get that. It's going to create those again. And this time, the body's going to react. And it might react a little bit more violently because it knows it doesn't belong. And so instead of now just me having 10,000 antibodies, it's going to take that up by an order of 10,000. And it's going to magnify that 10,000 antibodies into 10 million antibodies in my system. Okay? And it's going to attack that. And within 2 weeks, my system will now have all of that roaming around in it, so that if I am exposed to this and I get it, my body will react and I won't have it. That's how it works.
It's fortified with all of those thousands, millions.
So if I go out, like this, and I interact with people again, okay, and I get it, my body's going to know what it is immediately. It's going to react, and I'm not even going to get sick. Immunity.
So on that second shot, potentially your sore arm is going to be a little more.
My arm could be a bit more sore.
Could be a little more sore.
What I am expecting to occur is the following. My arm will get sore again, and this time I'll probably have the tiredness, perhaps the body aches that would go along with it. And it'll last for about a day and then it'll be gone.
Right.
That's what will happen. And then within 2 weeks, again, your body eliminates that and you go back to being good. It doesn't change me at a molecular level. I'm not going to be some zombie monster. Any of those things. But that's what it's going to be. Now, how do I know it's going to work? Well, believe it or not, I am part of the big experiment just like every other person.
Right.
This is novel for a reason.
Yeah.
We've never had to do it before.
Yeah.
We've never seen it.
Everybody.
But what people don't understand, and I think this is really truly the truth, I don't think they've quite come to grips with the fact that there is one overarching reality about COVID-19 or SARS-CoV-2. It is never going away.
Right.
The virus is. We are not eradicating the virus. It will be there. Like measles is still there, like polio is still there, like pertussis is still there. They're all still there. It will never, ever be gone. The choice we have as individuals, So if you're freedom loving and you're telling me that you are, here is your choice. Step up and become part of the solution, or be quiet and let me do my job without ridicule and without pointing and everything else. You asked me about people. We did a survey regionally. Cowley County, the residents of Cowley County really did a magnificent job of answering the survey. I was surprised. They were a lot more engaged than I thought they'd be. I think for the 6-7 county region that we had it done at the University of Kansas and Wichita State put it together, and they put it out for us. And we had more residents per capita from Cowley County answer that survey than they did any other county in the region. 60% of the people told me they will take it immediately. 60%. Okay, so if you saw some of my numbers and such when I talk to folks in the paper about, well, what does that mean to me? Well, it tells me, okay, if I've got 35,000 people and 60% are going to want it, then I take a look at that population, and then I have to take a look at that number of people and say, where do they fall? How many are older? How many are in these categories? Because what I want to focus on when all of that happens is, who's the most at risk?
Right.
Okay, who's the most at risk? If I only had to do it chronologically, I would start with the oldest and move to the youngest. But fortunately or unfortunately, I don't know, politics comes into play, and so you have competing interests, even in vaccine distribution. Which means that when I said to everybody, in my heart of hearts, I knew. Remember in my introduction, it said I worked for Kansas Department of Health and Environment, and I was part of I was the person that was the lead for the state, and I know about what the distribution plan was 6 years ago.
Right.
It's changed since then. But I knew even then, Cowley County wasn't going to get anything. Not from the first bunch. No. Phil, you know, we're realistic about this. It was, you know where it went? Johnson County, Shawnee County, Douglas County, Wyandotte County, okay?
And then to Sedgwick.
Sedgwick County.
Howard.
The big
And then
five.
We're all later.
The big five, and then all the rest of you.
Right.
And it's almost and I'm sorry, I'm kind of going over time. It's almost kind of a clown show sometimes, because they send out information to the local public health officers, okay? And they say, hey, create your plans. You know, your response is local. Do your jobs. And I do. I take it very, very seriously. And so I put the plan together. I look at the guidance. I understand who's most at risk. I know that my frontline workers, my hospital people, my health department staff. I know my first responders who are dealing with the public. They're all high risk people. So we get them taken care of first. And then for me, the next logical step was going to be, I got to go see these people in the long-term care facilities, and I got to get all their staff done. And we got to do their residents, because we want to stop that. You want to stop that 87 when I know that I can. I know my mom, who is in her 90s, living in a long-term care facility in Topeka, could die from anything at any point in time, and she will have lived a long and wonderful life, but I don't want to see her die from this if I can prevent it. And so for every one of those community residents in Cowley County, when I see them, I think of that one person that's most dear to me, and I'm like, no, I want to protect them. You know, I want to be the son. I want to be the provider, the protector there. They pulled the plug on those plans. It all went haywire. We didn't get any forewarning. All of a sudden, one day I got 2 boxes of supplies, and the next day I got a box of vaccine. We didn't even know it was coming. So Phil, you know, haven't been to see you since. But we didn't know it was coming until it was there. And then we're thinking, okay, here we go. So we go back to our plan and say, hey, let's start getting our first responders, and then I get a phone call. Hey, Tom, so many of those doses that you got, they're not yours.
Oh, they belong to someone else?
They're not yours. I'm like, really? Well, what's that about? Says, well, we knew you would help us, and you would get those to Elk, Chautauqua, and the other counties.
Oh, wow.
And I'm like, do you know what I'm doing down here?
You're busy as a
I said,
cranberry.
and now we gotta run around and deliver vaccine? Oh, and don't forget, you can't do it unless you do it a certain way that we say you have to do it. And I'm like, I don't even have the device to store it in like you want me to get it done. So I'm like, if you want me to get this out, you leave me alone and I'll do my job. Click. I call Chautauqua, I call Elk,
They can
and there's, what's the county right on the other side of Elk?
Montgomery?
No, not Montgomery. Montgomery's down low. It's a little bit further. Is it
Greenwood.
Wilson?
Oh.
Wilson?
Howard.
No, that doesn't sound right.
Howard.
Huh?
Howard County.
No, it's
Cherokee.
it's right. I mean, you go Cowley, Elk, and then it's right there. I think it's Wilson. Anyway, there were these three counties. So I get their administrators on the phone, and God bless them. These are young ladies that are nurses that's basically they have two people health departments.
Right.
And I say, this is the issue, ladies. And I says, I don't have time to run around with this. I says, I can get it prepared. I can get everything ready to go. We just got to figure out how to get it from point A to point B, C, and D. And so we came up with a crafty little plan. The sheriff from Chautauqua drove over. We had it all picked up, and we had it all segregated into three little containers. And he picked it up and took it back to Chautauqua. The gal from Elk went down to Elk, picked up 2 boxes, hers and the one from Wilson, I think it was Wilson, and went back up. And then Wilson came over and picked up theirs. And so we were able to get it there and get it done quickly. But that just in a nutshell is a glimpse of the bureaucracy that goes along with just how we have to do things and how it changes on a daily basis. The amount of documentation and the paperwork and everything else that we have to do for this vaccine is phenomenal. Okay. Number one, I'm going to have to know about you. I'm going to have to make sure that you understand the risks. You're going to acknowledge that. I'm going to get you that shot, and then I have to make sure you come back at the right time for shot number 2.
I will.
Okay.
I'm ready.
So those are what we have to do because we're going to manage you as that patient.
Yeah.
In the meantime, I have to make sure I'm telling the state and the federal government and everything else about where we're at response-wise in Cowley County. And I still have to go out to the fairgrounds. We have to test and all of that. So you can imagine I really, really, really want this to work so that testing can become a thing of the past.
Right, you won't have to be
Okay,
doing that.
and what we think will happen is the following. Okay, within the next 60 days, we should be into phase 2. Phase 1 is actually a misnomer. There's 2 phases, phase 1A and 1B. 1A is where we're in right now, making it available to everybody in that first group that was wanting to take it. 60%. That means 40% of our first responders, our medical people, have declined.
Why?
40%?
40%? Why is the question? I do not know, and I cannot answer that.
In this county?
Yeah,
In this county,
in our hospitals and
Yeah.
our city hospital, same deal.
no, it is.
Yeah, there's an article.
But here's the thing. I will not force you.
Right.
I will never, that is not my role. I have an immense power, don't I, Phil? Have I ever once abused it? I never will. But in times like this, I could overstep. And I won't.
Can't the hospital
Yes, an employer can, but that's
But they're not doing
That's
It's
different.
not you.
You come to the health department, you ask my staff, okay? Unless you have a really valid reason why you should not, you take it. It's the same with us with flu shots. You come to work for me, that's one of the things you must do. So, and at the health department, everybody but 2 people have taken it, and those 2 people were people who recently had the illness,
Yeah.
and we didn't want to